Come in.
Hi,
Hey, how you doing?
I'm good. How are you?
I'm doing good.
My name is Heather. It's nice to meet you.
Nice to meet you.
I'm going to be the nurse practitioner that is taking care of you today. The purpose of this interview is to obtain a focused history related to why you were here.
Okay.
Okay. Can you tell me your name
Ben,
and what is your age
50.
and what brings you in today?
Earache,
Okay. Which year is it?
my right ear.
And when did it start?
Probably a couple days ago.
And so when it started, did it come on gradually or was it all of a sudden?
All of a sudden.
And can you tell me where it hurts? Like, is it inside your ear or on the
Yeah,
outside?
inside my ear.
Okay. And does it hurt anywhere else, like around your ear or your actual earlobe?
No, just mainly inside.
Okay. Is the pain constant or does it come and go?
It's constant.
And how long does the pain last? It's pretty much constant all the time, or does it?
Yeah, sometimes it's worse than other times, but
Okay.
it's always been hurting here lately.
And can you tell me what the pain feels like? Like on a scale of 1 to 10, 10 being the worst, how bad is it on the scale?
Probably about seven or eight.
Okay. And can you describe what it feels like?
It's like a sharp pain.
Does anything make it better? The pain?
I've been taking Tylenol, and that seems to help a little bit.
And does anything make it worse?
At nighttime, it seems to be at its worst.
So is it worse when you lay down?
Yes.
Okay. And does the pain move or spread to other areas?
No.
When does the pain occur? Is there a time or day that it's worse or better?
At nighttime, it's worse. During the day, it still hurts, but it's definitely worse at night.
And does doing any kind of activity like running or exercising or even walking make it worse at all or seem to affect it?
Not really. It's been the same no matter what.
Okay. All right, so you said on a scale it's 7 or 8. And when you have Tylenol on board, how bad is it? Can you rate it for me then on a scale of 1 to 10?
Probably about a 5.
Okay. And do you have a history of any kind of ear problems?
No.
And any other medical problems that you have?
No. High blood pressure. That's about it.
Okay. Have you ever had any ear surgeries or been hospitalized for any ear problems?
No, I haven't.
And have you, other than the Tylenol, have you been taking anything else, like herbal remedies or doing any kind of compresses or anything like that?
No.
And what other medications do you take on a regular basis?
Just my high blood pressure medication.
Do you know the name of it?
Clothoridone.
Can you describe for me what it looks like? What color's the pill?
It's white.
Is it round or oval?
I think it's oval.
Oval.
Yeah.
Do you know your dose?
25 milligrams.
And are you allergic to any other medications?
Not that I know
of?
of, no.
And what's your current job?
Project manager.
So on your job, are you exposed to any kind of loud noises or any kind of dust or debris?
Only when I visit job sites, which is about once a week.
Okay. And who do you live with? Like, are you married or have
Wife
kids?
and kids, yeah.
Okay. Do you smoke?
I do not.
Have you ever smoked?
I have, yeah. I've quit since I was 34.
Okay. And how much did you smoke when you smoked?
About almost a pack a day,
And do you drink alcohol?
occasionally.
Okay. So you say socially.
Yeah.
And do you vape?
I do not.
Do you use any recreational drugs?
I do not.
Do you exercise on a regular basis?
Yes.
How often would you say you exercised?
About 4 or 5 times a week.
And how long do you exercise when you exercise?
About 30 minutes.
And what's your normal diet like?
I
Do you eat a lot of sugary foods or drink a lot of sugary drinks, or would you say it's pretty healthy?
It could be better. Probably eat fried foods just a little bit too much.
Okay. And is your job physical?
Somewhat. Not too much.
And do you brush and floss your teeth regularly?
I do, yes.
Would you say once, twice, 3 times a day for
Twice a day.
brushing? Okay. And do you see a dentist regularly?
I do, yes. About once a year.
Do you wear a seatbelt?
I do.
And do you have to wear a hard hat or earplugs when you're on your job?
When I go to the job site, I do, yes.
Okay. Are you pretty good about doing it?
Yeah, I have to. Yeah.
Okay. And do you have hearing aids?
I do not.
And have you recently traveled or been exposed to any infectious diseases that you know of?
No.
Do you have a history of allergies? We'll circle back
Just
around.
seasonal.
Okay.
Yeah.
Do you take anything for that?
A generic Zyrtec.
And that seems to help with your allergies.
Yes.
What about a family history? Do you have any family history of any hearing problems or ear problems?
No.
What about any family history of allergies?
Just seasonal.
So an over-the-counter medication usually helps?
Yes.
Okay. And any family history of kidney disease?
No.
All right, so I'm just going to ask you some questions, overall questions, How do you feel about your overall health? How would you say it is?
I'd say it's pretty good.
Pretty good. And have you had any recent vision changes or eye pain?
No.
Any eye redness or discharge, watery eyes?
No.
Any hearing loss?
No.
Nasal congestion?
No.
Sore throat? What about runny nose?
No.
Any sinus pain, like pain in your cheeks or your forehead?
No. Just
Any-
earache.
Okay. Any dry mouth?
No.
What about any cough
No.
or wheezing?
No.
No sneezing or shortness of breath? What about any rashes or itchy or dry skin?
No.
And I've asked you about your allergies, so I have that here. And any dizziness or headache?
No, I have an occasional headache sometimes, but I don't think it's related
It's
to
not
that.
related to
No.
this. Okay. All right. Well, thank you so much for your time. I appreciate it.
No problem. Thank you.